Have some people coming in. Welcome. We'll give it one more minute just to make sure everybody's here in the webinar, and then we'll go ahead and get started. Well, as people start to trickle in, just want to say welcome everyone to our webinar. We appreciate you being with us this evening, and it's our town hall session for CAPS Provider Relations. So CAPS Provider Relations is going to be taking on some of the roles that Maximus, our contractor, currently is doing. We're going to be taking everything in-house to streamline the services for you. And I'm sorry, I didn't even introduce myself. My name is Ann Panzica, and I am the Education and Outreach Manager. And part of our vision is, like I said, to bring everything in-house to make the experience for the provider much more streamlined and much more user-friendly, and basically to provide a one-stop shop for providers. So in that vein, we actually have a story that I'd like to share with you. And the story is really kind of a vision of what provider relations, the experience is going to be for our childcare providers. So this story is about Joe, and Joe is a future CAPS provider. So one day, Joe learned about the Georgia Childcare and Parent Services, or CAPS program, and he was intrigued by the prospect of reaching even more families and providing quality care to more children. So Joe decided to become a CAPS provider. So Joe was apprehensive about the paperwork and administrative processes that often come with these kinds of programs, and he didn't really know what to expect. Next slide. So Joe decided to call the provider relations number, and to his surprise, it was actually answered by a real person. She was helpful and courteous. Her name was Beth, and she was a provider support consultant. He was so happy to speak to a real person and get the answers to the questions that he had. Beth told Joe that the entire process of enrollment into CAPS is automated and that he would be receiving an email with instructions for applying for the program through the Georgia Child Care Administrative Payment System, which is the portal that we have, also known as Georgia CAPS. To Joe's surprise, the email with instructions was in his inbox that very day. The Georgia CAP system was a revolutionary tool that had simplified the entire process of enrollment. It was automated, user-friendly, and it streamlined the application process. Joe could hardly believe his luck. Next slide. All he had to do was take a picture of his required documents and upload them into the system. It was as easy as snapping a photo on his smartphone. The system processed the document swiftly, leaving Joe with more time to focus on what he did best, providing exceptional childcare. After applying, Joe scheduled a new provider orientation. He was pleased to see that there were multiple options available for him to attend. There was even after hours options. So he chose the evening session to attend virtually. The orientation was comprehensive, and he learned about programs that he had never even heard about in all of his years providing care. He was excited to have more resources to use in his program and share with families. He also had handouts and informations to help him as a CAPS provider. Joe received an approval email and was now a CAPS provider. Next slide. New families were enrolling, and he used the portal to view scholarships, enter attendance, view remittance statements, and see how much he was going to be paid. He always knew how much he was going to be paid by looking into the portal, and he was paid on time. Next slide. One day, Joe couldn't find a scholarship for a child in his care. It was after hours, so he tried the submit a ticket feature in the system. And the next day, he received a call from another helpful consultant that assisted him over the phone, and he was able to locate the scholarship. Next slide. The year flew by for Joe, as it does when you care for children, and it was time for him to complete his annual renewal. Next slide. Joe received a notification that he had 60 days to complete his annual renewal. Joe appreciated the reminder, but soon forgot about it as he was extremely busy with work. Joe received another notification at 45 days and was grateful for the reminder, but a parent walked in and he forgot to put it in his calendar. Then Joe received another notification at 30 days, and he decided since he had some time available, he would, which is rare, he would go ahead and complete his annual renewal. Joe was pleased with how quickly he was able to complete it as the entire process was automated. Next slide. And so Joe continued to nurture the young minds in his care, focusing on the families and children that he served. Joe had peace of mind because he knew that he was valued and supported by the provider relations team. So that is our vision for the new provider relations team and the new provider relations Georgia CAP system. And hope you enjoyed the story. So today we're going to be talking about just the project overview, the timeline for this change, the portal that I was discussing, Georgia CAPS, and some of its features. We're going to talk about how to prepare, and then we're going to have some time for questions and answers. So I'm going to go ahead and introduce you to our Director for Provider Relations, Kay Mayfield, and she's going to be going over the project overview with you.
Thanks, Anne. And before I get started, you may have some questions as we go through this presentation. So if you do, please put those in the question and answer feature in Zoom. There's a chat, but if you'll try to put them in the Q&A, we can make sure we can answer everything. And then we'll do those questions at the end. So as Anne was saying, well, first, I'm Kay Mayfield. I am the CAPS Provider Relations Director, and I've been working with DECAL for 26 years. I've worked in many, many programs at DECAL and came to CAPS in 2018. I worked in the scholarship administration functional area, and now I'm come over to build this team, help build this team, and so I'm excited to be here. So we've been working on creating this the provider relations team, and we're taking on the work that our contractor Maximus has done for about 22 years now, and they've done a fantastic job. But we are going to be taking on the work. So we're building this team to support our providers. And in conjunction with building this team, we are building a new system. So both the taking over the work and the implementing the new system, we are slated at this point to go live on November 15th of this year. So that's really right around the corner. But so the name of the new system is called the Georgia Childcare Administrative Payment System, and we're going to call that Georgia CAPS. And so the system will replace what you go into right now called the PBA or Maximus PBA, where you go in and you bill for your services. So you go in there and you submit your attendance and you see your invoices and you get payment through the PBA. Well, our new system will take over that. It will also will enroll providers directly in the system. So this system is limited to what we do for providers. It's not for parents. Parents will continue to apply for CAPS in Gateway, so that's not changing. So our system doesn't have anything to do with parents. Or, it supports them, of course, but parents aren't going to be doing anything directly into this system. They're not going to be applying. They'll still do that in Georgia Gateway. So we will be transitioning, like I said, both the system and the support work, managing your enrollment and managing your payments about that date. Let's see, one useful thing that you need to know is that when we transition the systems, you're going to need access to Georgia CAPS. So to prepare to access Georgia CAPS this weekend or after October 8th, when you log into the Maximus billing portal, you're going to see a message that asks you to review and update any of the users that are assigned to your organization to go into the PBA, to the Maximus billing portal. So when you log in this weekend or after this weekend, you'll get a message and it'll say, please look over this list of users. And if there's anybody that doesn't need access to the PBA and won't need access to Georgia Caps in the future, then you can go ahead and deactivate that user. You'll also be able or need to add any identifying information to any of those users. So you might see an email address. And it might ask you to add like the first or last name of that person. So you'll want to be prepared for that and understand or recognize email addresses and to go with the right people. Also, you will be asked to identify a CAPS program contact from that list of users. So this is probably a new concept, but what we're going to be doing is asking everyone to kind of designate a lead person at your organization to be that CAPS program contact. So when you see that list, before you can move on, not only will you have to, verify first and last names and email address, but you'll also have to designate someone as the CAPS program contact. So I think that covers the program overview. Now I'm going to go into the different teams that we have within the CAPS provider relations. So we have 4 teams: enrollment services, provider support, quality assurance and payments, and education and outreach. And we're going to talk a little bit about what each of those teams are going to do. And I'm going to pass it off in a minute to the managers of those teams so they can introduce themselves and tell you a little bit about their particular team. But before I do that, I'm going to talk about provider support, because right now we don't have a manager for that particular team, but it's a very important team. They are going to be the foundation here in provider relations, because they're going to be your first point of contact for all of your provider issues. If you have a question about anything, if you have an issue with like a payment or a scholarship, or you just need to understand how to bill, you will contact this team first, and they're going to try to resolve your issue. And that's the goal. But if for some reason they're not able to resolve your issue, then they're going to escalate it to one of the other teams if it's a billing issue, or they might escalate it to outside of our CAPS provider relations team to our IT department if you have a system issue. But our goal is to support you, and they will be there to do that. We do already have an email address in place for that. And we'll also, we're actually kind of pivoted recently. So this is new news. You're the first people to hear this. We'll still keep our CAPS number that we've had, that you've already been using, the not the Maximus number, but the actual CAPS number, and we can give that to you. And you'll still be able to call that number and be directed through a prompt directly to the provider support team. So that's a high level for provider support. I'm going to pass it over to Sarah in our enrollment services team.
I'm Sarah Ward. I'm the manager for the enrollment services team for provider relations. Our main jobs are going to be to enroll new providers that are new to CAPS, help you guys, the existing CAPS providers, to complete your annual renewal, do a transfer change of ownership. So one program moving owners to, or different owners to another program, the same program, and review all rate increase requests. So that's what we're here for you guys for, and we're here happy to help. So I'm gonna pass it on to Alicia.
Good evening, everyone. Thanks for joining. My name is Alicia Golden. I'm the Quality Assurance and Payments Manager. I'm here with our provider relations team. And I am not new to DeKalb. I've been with DeKalb for 10.5 years. So just recently transitioned over to this positions though in January. And so I'm excited about this opportunity and the new unit as well as our system. So specifically for our team, it's going to consist of myself, one coordinator, and 9 consultants. And we're going to be responsible for reviewing payments and provider invoices, payment requests, adjustments, those type things. We also have a new quality assurance feature where we're going to be able to support providers and ensure accurate payments. And so we're excited about these things that we've implemented, and I'm going to turn it over to Ann now for education and outreach.
Well, good evening, everyone. My name is Ann Panzica, and I am the Education Outreach Manager. A little bit about me. I actually came over from instructional support, so I've been with DeKalb a few years now. And prior to that, I was a child care provider myself. I was a preschool teacher, a preschool director, um, a site supervisor for a before and after school program. So I have definitely done a lot of work and with families and with children, and enjoyed it a lot. And then I was also a program manager for a child care payment program in California, and we also had resource and referral as well. So I've had a little bit of experience on that side of it too. And as a CAPS mom, I was a CAPS mom. The CAPS program is extremely important to me. So providers are extremely important to me, as is the CAPS program. So we definitely know how valuable each one of you are, and how valuable our families are. So education outreach is going to consist of 5 consultants and 1 coordinator, and we are going to be conducting outreach to providers, to newly licensed providers, to promote CAPS participation. So we'll be, reaching out to them maybe via phone and just letting them know about how wonderful the CAPS program is, so that we can have more providers and more choices for families. We're also going to be facilitating new CAPS provider orientations and also ongoing training. So if we identify a training need that providers have, then we will create and deliver that training. We're also going to be offering technical assistance in an effort to enhance provider success. So we will be providing live technical assistance, virtual technical assistance. We'll be trying to help you to be as successful as possible as a CAPS provider, whether it's with a system, or if it's just a CAPS question. We're here to help. And we're also going to be developing resource material for providers. So if there is an concern or something that providers need assistance with, and we really think that maybe having a resource document to refer back to would be helpful, that'll be something that my team would be creating. So very excited, and I'm going to go ahead and turn it over to Alicia Golden now to talk about some of the features of Georgia CAPS, our new system.
So before we get into those enhancements, we have a short video that we want to share with you about our new program, Georgia CAPS.
At Georgia DeKalb, Childcare and Parent Services, we're empowering Georgia's future. We're committed to empowering our childcare providers. That's why we're excited to introduce the new Georgia Childcare Administrative and Payments System, Georgia CAPS. This user-friendly portal is designed with you in mind, streamlining processes to make your job easier with features like attendance tracking, managing scholarships, enrollment, direct messaging, easy access to resources, real-time payment status, and more. You'll have everything you need at your fingertips to help make your job easier. We're here to support you every step of the way. You can connect directly through the portal. Georgia CAPS is mobile friendly, giving you the freedom to manage your account whenever and wherever it's convenient. By innovating our systems, we're paving the way for a brighter future. From submitting enrollment documents to tracking payments, the portal simplifies your administrative tasks, freeing you up to focus on what you do best, providing high-quality early care and education to Georgia's children and families. The new Georgia CAPS system, designed with child care providers built for success. Log in and explore the benefits today. Visit our website to learn more.
Okay, so that was a brief overview, but what to expect next, right? Our go live date is coming soon. So we will be migrating all of the data from Maximus into our new system. And that's also going to include your user IDs and access. So once that happens, you're also going to be able to enroll in our new system and will receive a user ID unique for logging into Georgia CAPS. And so we plan to migrate that information, and then of course you will be notified, so you will have immediate access to our new system. All right, next slide. And this is just a view of where you would enter your user ID and password to log into the portal. And this is just one of the many screen layouts and pages that you as a provider would have access to. This one in particular is just attendance tracking. So you'll be able to see how many weeks attendance has been in pending status or unsubmitted, as well as be able to review all of your attendance history. Okay, next slide. Okay, and then this is just going like, this is how the providers would see this in the portal, as well as all of the access information that they'll see on that left-hand side. And so this screen is just giving you access to click on the scholarships. So you'll see, if you'll go to the next slide, please. Okay, so with the scholarships, you'll be able to see all of your active scholarships, soon to be expiring scholarships, recently expired. Then of course, if you utilize the hidden scholarship feature, you would also have access to that information. All right, and then you're going to be able to contact, of course, our provider support team by phone, but also within our portal, you're going to be able to submit a ticket specific to any inquiry or request that you have, and you'll be able to see that information. And then, of course, then our communication will be also through our system, Georgia CAPS. Okay. And you can see this a little bit clearer, so you can see all of the different pages and information that providers are going to have access to, as well as a lot of new enhancements that we have. And a couple of those are going to be digitizing our attendance, submitting payment requests electronically, change requests electronically. You're going to be able to go in there as a provider real time, submit your request into any supporting documentation, and you're also going to be to see the status of your request. If it's pending, if it's been approved, you're going to be able to see all of that information in our system. And then it's going to give you a lot of abilities to really have access to information that you may currently not be able to fully see right now. So we're excited about these changes. Okay, next slide. Okay, so well, before we go there, I will say a couple of things with the attendance tracking that we are excited about, and we got feedback from providers, is that providers will now be able to enter their attendance daily. So they will not have to wait until the end of the service week on Sunday to submit the previous week's attendance. They will be able to enter their attendance daily, and then they will also be able to submit that service week's attendance record beginning on Friday at 5 p.m. They're not going to have to wait until over the weekend, unless, of course, you are a weekend provider. And then another feature is that where providers have to select the days, Monday, Tuesday, Wednesday, Thursday, Friday, there's also, if the child was in attendance Monday through Friday, you'll be able to select a checkbox that's going to capture that Monday through Friday selection, and you will not have to select every day when you know that child was present during that week. And then what you don't see here, and you heard me mention earlier, is that we do have a new feature, and providers will hear a lot more about that, but it is a quality assurance measure to assist you all in making sure payments are accurate. And so we're excited about that and are looking forward to the implementation of those processes. Okay, and so what do we need to plan on next, right? And so we're asking all of the providers to please make sure you're current and up to date as possible on submitting all of your attendance within the Maximus system. The plan right now is that you will have access to Maximus through November 6th, and you will be able to bill for all previous service weeks. And so we want you to be as up to date and current as you possibly can, and strongly encourage you that if you're not up to date now, I would go ahead and take those steps to make sure you are, because this will reduce any additional delays in payments and will have you current. And then, of course, once we go live on November 15th, you will then have access to be able to enter your attendance from the previous service week as well as the week of the 13th. Okay, and then the other thing was, again, reminder, Kay mentioned this, and we've talked about you receiving a new user ID. We just want to remind everyone to make sure that you update your user information with Maximus, and delete anyone that you don't want to have access to the system, because we are going to migrate that information into Georgia CAPS, and you want to make sure that you have only the applicable parties that you want to have access to the system when we transition and go live. All right, I think that's it for me, and I'm going to turn it back over to Ann for training.
Okay, so we definitely are going to have options for all of you to be trained in the system and to be able to see how to use the new system. So there will be training videos, and we will release those and let you know when they're up and ready, and where they're going to be hosted. We'll also be having virtual office hours. So our team will set up certain times during the week that we will be able to offer to providers, to where you can just go ahead and join and ask us any questions that you may have, or if you need assistance with a particular issue within the system, we will do our best to help and to provide that assistance that you need. And we're also going to have, resource materials that we'll be offering as well. And we're also going to have ongoing technical assistance. So even after our go live date, we're going to be providing provider support and education outreach. We'll be able to help you navigate the system and help you if you have any, if you need any technical assistance. So that's some of the support that we're going to be offering, and we will be providing more information about that. But we would like to, we'd like to ask you to please complete a survey to share your preferences for training sessions. So that survey right there is to see what platform you prefer. So what method of delivery you would prefer as a provider for us to utilize. So whether it's Zoom or Teams or whatever you feel comfortable with, we want to make sure that our platform meets your needs. So if you have your smartphone handy, you can go ahead and scan that QR code. If not, the URL is right there, and I can also drop it in the chat. So please make sure that you do that you fill out that survey so that we can make sure that we're meeting your needs as a child care provider, and that we're delivering the training in a way that is best for you. And so I am going to go ahead and hand it off now to Sarah. Sorry, I'm
Thank you,
looking
Ann.
for the link. Thank you.
All right, so during the transition, for any payment related or enrollment questions, continue to contact Maximus. If you've contacted Maximus and you still have not gotten a resolution, you are more than welcome to contact us, and we'll be more than happy to help. Next slide. And then if you have any questions, you can go ahead and email us at capsprovidersupport@dcal.ga.gov, or you can also visit our website. It's on the CAPS webpage, and we have a provider relations tab that you can click on, and it gives all of our updates for what's been happening and what we're going to have moving forward. All right, so now we're going to move to the question and answer portion.
So I see that we do have some questions here in our question and answer box. If you would like to go ahead and add some, we have plenty of time to answer questions. We only have 5, I believe, right now in our question and answer box there. So you can either put them into the chat, or you can go ahead and put them into at the bottom of the screen where it says Q&A. You can click that and then add your question there. So I'll start with the first one. Will providers continue to click for COVID until next year? So Alicia, would you like to handle that one?
So yes, in Georgia Caps, you will still have the ability to select COVID. You just want to make sure that it is in line with the emergency policy when you are selecting COVID. So this means that the child is still enrolled in your center, and that they are absent for a time that they've attended once before, and still enrolled. And so if you have a situation where a child was not there for a week, then you may select COVID. But if a child is no longer enrolled, and you are aware of that as a provider, then you would not want to continue to bill for that child. So, but for right now, with the emergency policy waiver, as long as it's in effect, then yes, we will have access. You will have access to select COVID.
So there's another question about rates. It says our rates have been locked for some 2+ years. So when will the provider be able to update the new rates?
Yes, so we will have a feature in our system, Georgia Caps, that you'll be able to submit rate increases. However, that feature will not be available when we go live because, as you're mentioning, rates have been locked. And so we obtain your rates during access, and some may have been back as far as 2021, if that's when you were still a provider under Caps. And so what Caps has done, and Decal, to offset the lock of your rates during access, is in October 2022, they gave a 7.87% increase that was applied to your provider rates overall. And then in January 2024 of this year, because provider rates still cannot be increased, Decal is again increasing provider rates by an additional 4.3% in sometime in January 2024. So that is the plan to be able to give an increase while we are still paying based on provider rates.
And let me, if I could add to that, just so there's an understanding of the reason why we needed to kind of set the base rate. We got this the federal money because of the pandemic, and to allow us to be able to pay the providers full published rate, including the family fee, the differential, in order for us to be able to pay all of that. And pay all of our providers and pay you, and for the period that we wanted to pay you, we had to have some kind of base to be able to forecast the ability to pay the full rate. If we didn't have kind of a set basis for us to be able to forecast how long we would be able to pay that entire rate, if we allowed providers, everybody, to increase at different times, we probably would run out of money and we wouldn't have been able to pay that full rate for the entire period of time. And so that's the reason why we had to do that. But as Alicia said, we have increased first that 7.87% back in October, and we will be increasing again. So just wanted to give everybody the understanding of the reason why it's not because we don't want to allow you to do it. It's not because of that. It's because we want to be able to pay the full rate, and we want to be able to pay all providers the full rate, because if we didn't do that, we would have to stop it earlier, or maybe only have paid some people. And we didn't want to do that. We wanted to pay everybody the full rate.
So the next question was, can the portal, or will the portal, go back to showing how much providers receive per child on the main screen instead of seeing errors on the remittal statement?
That's a good question. So the answer is yes. We've made sure that we've incorporated that. We understand your current view right now is a little difficult because when you look at your gross pay, it does not align with the total paid. And so the gross pay is still aligning with the state maximum rates instead of you being paid at your provider rate. But going forward in Georgia Caps, you will be able to see the actual amount that you're being paid, and it should match your rate. And so right now you may see the term, and let me make sure I say that. You may see gross rate right now And then in Georgia Caps, it's going to be called base rate, but it should match. Like you should be able to basically go across each line item and get to your total amount, and it would match that total. So that is definitely going to be the case in our new system.
So next question is, will CAPS remain paperless? And the processes of enrollment is going to be automated. And so CAPS will be, or provider relations will be paperless. Next question is, can you give info about the new pilot program? So if we're not able to get to some of these questions, or if we need further clarification, we will be putting them into an FAQ, and that will be sent out, or that actually will be on our website that we gave you earlier. So you can refer to that, and we'll make sure that we get to every question.
But
So
if you could clarify which pilot program, because we actually have quite a few.
Yes.
So help us with that.
We also have another question, though, while she's providing clarification there. Will providers be able to keep the same password and username?
That is a good question. And I would say you're probably going to have to reset that because we're going to, when we migrate over, we probably won't have that information stored in the system. And that would be a security issue. But that's a good question, and not one that we've actually addressed yet with our vendor. But my guess would be you're going to get a email, and you're probably going to have to log in, and you're probably going to have to reset it at that time. Now, if you choose to use the same one that you've used before, you can do that, but it more than likely won't be that it's there and you can just log right in when we first migrate.
Okay, so there's another question about multiple sites. If a child changes sites, will that child be able to request a change of the provider? So I think that's referring to, I'm not
we
sure if
have
that's
multiple
referring to the
sites, so
child.
maybe multiple centers, and if the child changes sites, we'll be able to request a change to the provider. So yes, but ideally, you should instruct the parent to submit that change. So if they're changing locations from one facility to another, even though that you are the owner of all of those facilities, ideally you would want to have the parent to report that change. However, if there's any issues faced with not being able to successfully have that happen, then of course you can reach out to provider support, and we would be able to assist you.
So I saw, are we now having parents pay their portion? So families are now to pay their family fee, and that is what they're responsible for paying now, and that's present on the scholarship, so you can view what that amount is on the scholarship.
And I'll just add to that, it's not the parent's weekly responsibility though. So there's two separate sections. You should see the family child fee, and then you would see parent responsibility. So the only thing that has changed effective 10/2 was that families are now responsible for paying their family child fee, right? And so you would still only be requiring them to pay that portion to you. But if you see on the scholarship parent weekly responsibility, you're not to collect that at this time. We have not fully removed access yet. And so in our emergency policy, so you would only want to be collecting the family fee. And if you see that there's 0 on there, then you wouldn't have to collect anything from that family.
So then there's a question about informal providers and what effect it will have, this transition will have on informal providers. So I'll answer that a little. So as far as all CAPS providers, so all of the data that's currently being stored by Maximus is going to be migrated into our new system in Georgia CAPS, and that includes informal providers. So I'm not sure if anyone wants to add to that, but I believe that'll be the only effect it's going to have on informal providers versus other providers.
I think so.
Let's see if there's another one. So there's
We may have answered that about the family. I think they said family rates, but we're talking about the family fee and I think we may have answered that one. If you want to go to the next one.
Okay. So are we going to have a new provider ID as well? That's another question.
Your provider, when you say provider ID, do you mean so what we've called provider ID is the number that is assigned to you by Maximus in the provider billing portal. So if that's what you mean by provider ID, that will stay the same. So the number that's assigned to you both by Maximus, that really has been used by CAPS as your what we call PID or provider ID, that will remain the same, as will the license number, of course, that you're assigned with the CCS team. So that will remain the same.
And so there's a question about department matching families to providers. So families select their providers, and we do offer, qualityrated.org is a great way for families to be able to locate providers, but we don't actually match families to providers in CAPS.
There was a question, Ann, about can parents make up the difference between the published rate that they have for CAPS and the rates for that center. But the answer to that is no. You cannot require a family to make up the difference if they are a CAPS recipient. The only thing you should be collecting from a CAPS recipient is the family child fee at this time.
So there's a question about quality rated tiers and whether or not they'll be affected positively.
There should not be a change in your quality rated tier. If you're quality rated and you have the tier bonus, then all that information will migrate over. And the only thing that could change with the tiers would be slightly when, if anything changes as far as like the base rate and things like that. But overall, your tier percentages will remain the same.
So there's a question about invoicing, whether or not you can invoice from a cell phone.
I believe that you'll still be able to submit your attendance and things like that from an iPad or a cell phone. So yes, you should be able to do that. It would just look a little different, I'm sure, on the layout.
And then there's a question here about family fee or parent responsibility.
So you should only be collecting the family fee, and at this time, you should not be collecting the parent responsibility. We have not implemented that back yet.
A couple here. So it talks about, or there's a question about, will the tiered reimbursement amount be increased anytime in the near future?
Right now, we don't have anything that we plan on increasing, because during the with the CAPS emergency policy waiver, right now the rates were already increased for your tier bonus. So there has not been any mention, but you never know what would happen in the future. So, but right now we don't have anything slated for an additional increase in your tier for quality rated.
So we do have some questions in the chat. Okay, have you been looking at any of
Yep.
the
I do. And and I also want to address the question about why there's different rates paid to different providers in different counties. So the reason for that is we base those rates based on a market survey. We have to do a market survey every so many years. And we establish those rates based on the cost of care in different counties, but different regions within Georgia. And so in metro areas, the cost of care is typically higher. And so as in then in more rural areas. And so those rates are set based on that the survey the market analysis that are done, that's done. And so that's why there are different rates paid for different zones in Georgia. And then the questions we got from the chat. There's a question about charging the family fee for the weeks that COVID-19 is claimed. So when you're using the COVID-19 option, that we have a temporary emergency policy that allows you to claim that if a child enrolled in your facility before a certain period of time and the child didn't attend. So if you're claiming COVID, that means the child's not coming to your facility. You're claiming under that emergency policy. If a child's coming to your facility, you shouldn't be claiming under that COVID policy. This is only when the child's not coming to your facility. So if the child's not coming to your facility, then you need to abide by whatever policies you have in place to for charging the parent their portion or that family fee portion, right? So for example, if your policy says kind of similar to what we call holding slots, in CAPS, we allow providers, if they have in their policy, to claim up to 2 weeks a year, as long as it's in your policy to say, you parents, if you're enrolled in my facility and you aren't coming for a week or whatever for vacation, we're still going to charge you. So if you have this policy in your procedures that you would charge the family under those circumstances, then that's your policy, and CAPS is not going to prohibit you from doing that. When it comes to COVID, again, you're claiming COVID because this is an emergency policy, and but what you're doing is claiming it when the child's not attending. So if your procedures allows you to have a parent pay their family fee for the period of time, then that's your prerogative to do so. But if a child hasn't been attending, for beyond whatever your policy and procedures allow, then you shouldn't be collecting that family fee from the parent. So, but CAPS will still pay you your rate minus the family fee, whether or not that child is in attendance. So there was another question about rates not being correct and who to contact for that. I would suggest, Alicia, let you handle that. So make sure that you get the right answer there if their rates aren't correct.
Right. So, again, with Access, we would have obtained your rates sometime between 2021 to present period, depending on when you became a CAPS provider. And then with Access, we would have taken those rates. We would, in October 2022, we would have applied 7.87%. And then that is what we have on record. So if you're saying that your rates are not accurate, you may send a request to Provider Relations to inquire about that. However, if it's not aligning with rates that you may have increased for non-CAPS participating families at your center, then they would not match. So just keep that in mind. Like what we have on file would have been your rates that we would have collected in 21 or 22, and then we would have applied a 7.87% to it. And so your rates may be different if you've updated those just for your facility as a whole, right? And you're allowed to charge whatever rate you choose to for your families that are attending that are not CAPS recipients. But for CAPS recipients, those rates are locked in right now based on the records that we have on file. Now, if you have specific scholarships that you are not receiving that rate that is based on what we have on file, then definitely you can inquire about those, or if you needed to confirm what provider rates we have on file, then you will absolutely be able to do that. And then once we go live, we will actually we'll have your provider rates in the system, and you'll be able to see those for yourself.
So there's a question too about access and whether or not it's still in effect until September 2024.
Yes, right now, if you went on our CAPS website, you would see a link to the most recent emergency policy memorandum, and it gives you the specifics, one about, things that are currently still in effect, like the COVID billing, temporary closure, also the change that it was implemented on October 2nd about the family fees, and that's the only thing that we should be collecting. And then it's right now, it gives you dates that saying it is through September 29th, 2024. And so you can always refer back to our CAPS website to see anytime there's any information or letters or notices that have been sent out or changed any of that information.
So there's another question. What is the last week we will receive payment prior to the system shutting down?
So the last day that you'll be able to submit payment or submit attendance in the Maximus PBA is going to be on November 6th. And that will be for the week of October 30th. Okay. So this is why we strongly encourage the providers to have all of their attendance up to date and submitted so that it will not delay any of those payments. And then Maximus will process those. Then there will be a delay within the service week of November 16th, 13th, and 20th. But we will go live on the 15th. You will be able to enter your attendance for November 6th and November 13th week. And then from there, there's going to be one other delay in the first initial startup of your payment. And then it should then start on a weekly, every other weekly basis, you will receive your payment. But that'll be the transition period. And as long as you're up to date in the PBA, then those are going to be the only delays. Now, if you didn't submit attendance from prior to November 6th in Maximus, then there could be longer delays because you wouldn't have submitted those payments. And so we're not issuing the first payment until or around that last week or so in November.
There's another question. Why does CAPS ask for a rate sheet for every child that applies for assistance? And why aren't the rates just in the system?
So that's a good question. The rates are in the system. So if you, and if a parent would obviously possibly be telling you this, but you do not need to provide your rates to a parent, and they do not have to submit that when a parent is applying for CAP. We have your provider rates on file, and they should not be submitting those during their application process as a family. So I hope that clarifies that.
So there's another question about bank payments, whether or not bank payments would remain the same. I think probably during the migration, would migrate over.
So we're going to migrate your information over. So make sure that your banking information is up to date and current, and then it will migrate over into our system.
There's a question about the supplemental payments and whether or not those would be received along with the last Maximus payment.
It will not be with the last payment. However, it will be kind of in between those weeks that you're not receiving a payment. Maybe, sometime around the week of the November 20th, somewhere in there, it's going to be able to offset that gap where you're not getting a payment for a few weeks.
I think that we have gotten most of them. Oh, here's another one. Did you say our payments will change from weekly to biweekly?
Yes, it will look a little different in our system. And one of the reasons why is because we've implemented a quality assurance process that you may have heard me talk about earlier in our webinar. and it's ensuring accurate payments. And so right now, the cutoff time with Maximus is on a Tuesday, and you receive payment later that week. The difference with our new system is that the cutoff will still be on that Tuesday. However, you will not receive payment until the next week for that service week. And so not a huge delay, but just a couple of days that are added there. And the reason that we did that was, one, for processing of payments, and also for our quality assurance process, which will be very helpful for providers in the long run to make sure that accurate payments are going out.
But to clarify, Alicia, they will still receive a payment weekly.
Yes, it's just like first getting going. You know what I mean? Like,
there'll be a one-time gap,
yes,
and then you will still receive your payment weekly. And for that gap, we are providing that supplemental payment to bridge that gap.
Yeah. And just right now, and I think that was just trying to explain the difference too, right? Like with Maximus, you currently get your payment within the same week that you submit it. And so once you get going in our system, you're still going to get paid weekly. It's just not going to be for that same week that you submitted it. It'll just kind of be the week after, if that makes sense.
Mm-hmm. And the supplemental payment is slated to be sent out right now, the week of November the 13th. It's the week before Thanksgiving.
Okay.
And that's going to be on top of the regular payment. So that's a bonus, an additional payment. And then there's a question about, will we receive reminders of the payment delays?
So they would we'll definitely keep you abreast of any payment delays, but they should only be a one-time gap when we transition from the PBA to the George Cap system. Anytime there's transition of systems, there's a lot of testing that has to be done to make sure that everything's working correctly and the data is migrated. So it's not something that you just kind of can, do without some really good intentional testing to make sure things are working correctly. And so that's going to impact, of course, that payment. But that should be the only delay. But of course, if there are any delays in the future, like Maximus does right now, we would be sure to notify providers if there's going to be any kind of delay in the future.
Okay, did I miss any? Oh, looks like there's another one. Will we continue to receive the backpack notices?
Oh, there would be no change to that. That's a family support effort that gets sent out to remind providers that a family's case is for renewal. So there will be no change in that.
So there's some other questions here. So a question about, what is my responsibility to submit when a child is in the application process for CAPS?
So for you as a provider, there wouldn't be any responsibility until you receive the scholarship. So if they are still in the application process, once they are approved, you would receive a scholarship. And then that is when your responsibility kicks in and you're eligible to bill on that scholarship and submit attendance and all of those things. But in that interim phase or renewal phase, there's not really any responsibility for you as a provider. That's on the family.
Okay, do any of you see any questions I've missed here?
And we have somebody asking about how does CAP stay aware of school holidays and closings?
So you're talking about for variable scholarships.
Yes.
So what happens is when we get the school calendars, and Maximus has done this work, and they did this work this year. And so when at the beginning of sometime around June's the typical time, when school systems post their schedule for the upcoming year, that calendar is obtained, and that those full week schedules, full weeks when school is out, basically for a full week, that information is entered into the system, and the same process will take place in the new system. So that's all done at the beginning of the week, at the beginning of the school year. But unless a school closes for an entire week, we don't keep up with like 1-day holidays and things like that. We only need to know like if a school is closed for an entire week, because that's what impacts the schedule. Like being off 1 or 2 days, you can still bill for part-time. And so we keep up with when the school is out for an entire week. And so other than that, their school calendar for the year, usually only emergency type situations occur, like snow weeks. It would have to be a snow week, is when we would update. And those would be, you kind of know that when school is out because of a snow. So we try to keep up with it. We'll try to keep up with it with being able, with news reports and things of that nature. But sometimes, honestly, it's when the provider tells us that, if we aren't aware of it and we are notified by the provider, we would make that change in the system.
Well, we're now at 7, so we'll go ahead and any questions that we have not been able to answer, we are going to be capturing in the FAQ that we will have on that website. So we'll make sure to address all of them so that you're all informed of this transition.
Okay, so we just want to thank everybody for attending. We know that, after you get through taking care of children, your nighttime is your private time to relax. So we appreciate you coming tonight and listening to this information. And so just to close it out for us, we just want to let you know that the reason that we're making this change and taking on this work is because we really want to optimize your experience. And so you see our vision here. We want to be able to optimize all providers' experience with CAPS. And because we understand decal, we understand decal programs, we felt like having that institutional knowledge to be able to coordinate all the programs would be useful to you, because a lot of things, you're in a lot of programs at decal. You may be in the CACFP. If you're licensed, you're definitely in quality rated because you have to be quality rated to be on CAPS. You may be participating in pre-K, and us being part of decal, we kind of have that inside knowledge, right? Whereas with a contractor or a third party, they don't have quite the same knowledge that we do. So we hope that bringing this in-house, we can coordinate all the different services of decal. And, we want to create systems for you to be able to streamline your work. We're moving away from a lot of paper processes. And so that's really our vision for you. And, when we first implement, there's probably going to be some bumpiness. So we're not going to say everything's going to be perfect. But we're going to partner with you, and we're going to make it a success. So thank you for coming. Thank you for your time. And we look forward to seeing you again soon.
Thank you so much. Have a great evening.